Hello, thank you for joining us today, Dr. Cafazzo. Dr. Cafazzo, you were the lead author of Chapter 3, Design for Digital Health of the book published this year, Design for Health, Applications of Human Factors. I'm excited to ask you a few questions about the chapter and yourself. Why don't you start by telling us a little bit about your work and your research focuses?
Thanks, Grace. So I am a biomedical engineer by training. I studied electrical engineering and did graduate degrees in biomedical engineering and health informatics. And I was a practicing biomedical engineer for a number of years, and slowly started to understand the benefits of e-health, telemedicine, and obviously eventually digital health. At the same time, I was also experiencing all the challenges of implementing technologies in clinical spaces and with patients. And so that's when I started working more closely with industrial engineering and human factors engineering groups at the University of Toronto. And this slowly evolved to the point where we started employing students, and they went on to do graduate work with us at Toronto General Hospital, where my lab is. And eventually we built up a team of human factors engineering professionals dedicated to healthcare. They're called the Healthcare Human Factors team. More than 30 people who are dedicated to this and reside within the University Health Network, which are the teaching hospitals of the University of Toronto. And so over the years, and we've been around now for 16 years, we've applied it to typical medical devices and technology, but more and more we've been applying human factors engineering design principles to digital health. And so I felt it important when there was this opportunity to start writing about this topic. I really felt that we needed to bring in everything that we've learned about human factors engineering in clinical contexts and build upon a lot of the digital health work that we've been doing. So in parallel to all the human factors work that we do for industry and that we do for the hospital, we started creating original intellectual property for digital tools that are applied to mostly chronic disease management, clinical care, and patient self-management of chronic conditions. So, and some of the examples, I go through them in my book chapter. The one most prominent one is Medley, which is a heart failure management application. But we've done applications for kids with diabetes, adults with type 2 diabetes. We've done pain management applications for children. We're in the midst of designing a platform for kids with arthritis. We also do respiratory care. We have a Breathe app, which is for asthma and COPD. And we're even more recently about to deploy an application for cancer survivors. So yeah, we've done a lot of digital health applications, and again, more and more emphasis not just on the design of the application, but the design of the system that it's going into. So really, it is more about the model of care than just the digital health intervention.
Thank you very much. So your chapter focuses a lot on, designing for more modern times, right? Taking into account how integrated technology is into our daily lives. Can you give us an overview of your chapter and why it's important?
Yeah, I really wanted to address something that I often think is missing in design when it comes to healthcare settings or designing for patients directly. And I introduced a concept which is not a new concept. It's existed for decades, but it's not really that often used in healthcare. It's the notion of service design. And service design, I introduce it alongside the concepts that Kim Vicente introduced years ago with the human tech model. And what Kim said back in his writings and in his book, The Human Factor, was that the human tech ladder is a more holistic, systemic way of viewing how you design and implement technology. So it includes all the things we know about UI and UX design, the cognitive and the physical aspects of products, but then brings in things like team, organization, and policy. And these are huge factors in healthcare. And they have an overwhelming effect on the adoption and use of technology. So I started introducing these concepts that in order to create really pervasive technologies that can scale well, you cannot just focus in on the lower rungs of the human tech ladder, the aspects of the physical design or the UI design. Those are often, we know that those are important aspects, and they can be, they can be critical in the success of a product or service. But unless you understand how your product or service is going to deal and interact in a team environment, what the organizational aspects and how it's paid for, how it's resourced, and then the policy implication, because healthcare is highly regulated. It's depending on what system you're on. In the U.S., there's policies all the way from how the insurance companies deal with technology through how governments, both at the state and federal level, deal with technologies. Whereas in Canada, with a single payer system, the rules are different, and the way technology is treated is different. But it all falls into your design. And one of the methods that I introduce in the chapter is the concept of service design. And as I said, it's a concept that is not new, but is not often applied in healthcare. And the reason, and in fact, in the course that I teach at the University of Toronto, my course used to introduce the concepts of change management when delivering on technology, implementing technology. And I found that over the years, change management did not address, you could still fail despite using lots of robust change management techniques. And what I found is that service design is far more effective in that respect. And so the concept of service design is actually really not unusual for most designers, because I think if you understand the concepts of user-centered design and just start widening your scope of your interest to not just the UI or the physical aspects of a product, but start thinking about your product as a service and how it affects the model of care. And even if you're bold enough and you have the stakeholder engagement, changing the model of care to encompass your product as part of the service being delivered. So in the particular use case that I have in the chapter, is I talk about our implementation of a heart failure management application, Medley, into our heart function clinic. And really what we're talking about is not just the introduction of a digital health intervention into this clinic, but really changing fundamentally the way they practice, changing the model of care, changing how patients are managed who are on heart failure. And so when you look at that more holistically and you do the typical workflow analysis, but you're looking at it from the experiences of the patient and the experiences of the clinician, you get great insight into understanding what the barriers are going to be for that technology. And I think since COVID, the pandemic has occurred, we're learning more and more about digital health and how it's very difficult just to layer it on top of an existing workflow. It's much more important to think about it from the perspective of a service and how well it's going to be integrating into your workflow.
What is the most important takeaway from this chapter for designers, researchers, and others interested in, the topic, i.e. telehealth,
Yeah.
e-health?
Yeah, I mean, some of the things that, it's really about some of my experiences of designing digital health products and services over the last 16 years. And I think one of the lessons learned is how important it is to observe these interactions firsthand. So how is it that you inform your product? And I often say, and it's a title within my chapter, is this notion that healthcare is very opaque. So the complexity of healthcare, how esoteric some healthcare applications are, it's such that you cannot, I don't think you can effectively design by hearing specifications or needs and wants second and third hand around, around a conference table. That's not the way to get to understand the problem that you're trying to solve. And it's a huge effort, but if you can spend the time in the clinical environment with patients, with clinicians, interacting, that's truly how you get to understand the problem that you're trying to solve. And this is becoming rarer and rarer to have this opportunity. And it's largely to do with a lot of the privacy laws. It's not easy for a student, a designer, someone in industry to get into healthcare environments. It's not impossible. It's just harder than it was in years past because of privacy rules and policies. But it is worth the effort, and you could not really do things like service design if you didn't have the ability to observe the workflows and the interactions between individuals, clinicians, patients, and the product and service. You won't be able to glean that from interviews or again a roundtable and discussing what's needed in the clinic. And you won't be able to test on it and iterate on it either if you're not to a certain extent embedded in the healthcare scene. And so that's what I'm really suggesting, is that people take the time to understand their problem by rolling up their sleeves and getting into the clinical environments to learn more about the problem they're trying to solve. I also talk about, I do 2 case studies in the chapter, and one of them is an example of what went wrong, and the other is what went right, and it is about learning from your experiences. And the one example that I cite is something from about 10 years ago about designing this vital signs application. And this vital signs application is such that very simple application allows nurses to document vital signs electronically. And but back in those days, we were in a change management mode and didn't fully appreciate the utility of service design. And so we didn't do it. And despite the fact that we rigorously tested this application in a state-of-the-art usability lab at Toronto General and iterated on it, and the application was perfect, it still failed. It still failed. And for the reasons I give in the chapter, there are so many blind spots when you're designing for healthcare, and all the more reason to get in there and mix it up with the clinicians in the clinic to understand the challenges. So I go into some detail about really learning from those experiences and not being afraid to iterate, and also having, honestly, really good stakeholder partners who really trust your judgment and trust the process as well, because it's not an easy one. It's inherently iterative and critical process.
Fantastic, thank you. I'm wondering, can you elaborate a little bit on the blind spots that you often see in healthcare?
Well, I mean, once you get to the point, and I use this example in the chapter regarding this vital signs application. So, as I said, the application was extremely well designed. It was validated through multiple iterations of usability testing. But during the orientation, one of the the nursing informatics coordinator let it slip that the use of the application was going to be centered around a research study for a graduate student. Now, what some of the nurses took that to mean was that it's optional, right? That it wasn't necessary for them to use this application because, they are clinical nurses and they don't do research, so they viewed this as optional. This is to me an example how careful your communications need to be with the written materials given, how it's communicated to individuals, because the struggle that we had as a result of this orientation that the nursing informatics coordinator did was such that, again, some of the nursing staff didn't take this application seriously anymore because they didn't believe it was part of the clinic. It was more of a research project and hence being optional. It doesn't take much for the implementation of a digital health intervention to go awry, and just a few misplaced words can convince people that this is not for them. So that's just an example of, and I go into some detail about how thorough we were with the medley process in terms of how it's communicated, what its purpose is for, everything from written materials to verbal, how it's verbally communicated. All those details are taken care of. And you see this in other industries, right? You see this in other industries. You see it less so in healthcare. And I wanted to get across to people the importance of this level of thoroughness, of comprehensiveness, of rigor in that design process. So you have to be thinking about all of the elements around your application and your service in order for it to be effective and to be able to scale.
Oh, fantastic. Thank you, Dr. Cafazzo. Those are all the questions that I have for you. I really appreciate your time today, and I look forward, and ACE Lab looks forward to sharing this as well.
All right. Thanks very much, Grace. Pleasure.